Hi, everyone. This is another installment of the Pre-HAT Student Organization Spotlight Series. It's presented by the UCLA Career Center to introduce students to some of the great existing pre-HAT student organizations on campus. Today's event hosts STEM News Nexus at UCLA, Scopeational Advocates, and Medical Aid Initiative. And without further ado, I'm inviting Nina to introduce the first student organization. Let me stop my share so you can share your screen. Hi, Nina, nice to see you again.
Hi, Christina, nice to see you again. Hi, everybody. I'm sharing. Okay, welcome. So our organization is called STEM News Nexus at UCLA, blog of preprints and new publications. And our primary purpose is to disseminate scientific information for a STEM audience by creating a blog, news podcast, and publishing posts on social media. The reason why we think that this purpose is important is because reading scientific literature is difficult. There's so much jargon, so much math, so much everything. And but there's so many new discoveries happening every day, things that are disproving textbooks even. And I think it's just so important, just as a good scientist, that we have a system to keep up with everything, to make sure that we are up to date. And so, and we also just want to promote more STEM literacy in our community by getting people to have more practice reading scientific literature, and also familiarizing students with lab techniques, as surely that could help promote great scientific discovery in the future. And we also to develop critical appraisal skills and familiar ourselves with lab techniques will help us better understand papers, think more critically, and understand really the truth of what is being presented. An additional purpose is for us to just build a STEM community and create networking opportunities so that we can just have a strong way to grow and develop our careers as people who are really passionate about what we do. So what we do right now is that we have a weekly broadcast on our YouTube channel, which is called STEM News Nexus at UCLA. We post there weekly. We're working on trying to get more people to watch our videos, and you could be an important person helping us with this. And we are currently reopening our blog, stemnewsnexus.com. And within this quarter, you'll be able to see all of our blog summary posts written there. And we're also coordinating with faculty members to create networking events and paneling events but these will be mostly for our active members. So benefits of being part of our organization as a pre-med is that presenting, for our broadcasts especially, we have to present succinct scientific reports, which is kind of like giving a patient report to an attending physician as a resident. Like, think about it, you're in the hospital, you're researching, looking for all the clues of like what's going on with your patient, and you're going to have to try and explain that to different healthcare professionals so that everybody can work together and do the right thing to help the patient. So these types of communication skills to get everyone on the same page with really complex information is imperative to being a good physician and scientist, or just physician, and which is very important for just the art of medicine. And also you can free read scientific stuff about medicine and learn about, and just get really excited and talk about what you read during your interview at med school. And you can also demonstrate your drive and passion by struggling to read papers as an undergraduate in your free time, and also struggling to disseminate this information because you see the value in it and just really want more people to know what you learn. And also, active members get exclusive resources to help get into medical school. We have a lot of workshop updates, and we try to get discounts for different MCAT study prep resources. And we also like to share different tips and tricks about getting ready for medical school. So if you're interested, our application is on our link tree, so connect with us. Our link tree is STEM News Nexus. Again, our YouTube channel is STEM News Nexus at UCLA. Our Instagram is STEM News Nexus, and our email is stemnewsnexus@ucla.edu. And here is a wonderful quote by Jean Paget. I believe that's how to pronounce it. It's that scientific knowledge is in perpetual evolution. It finds itself change from one day to the next. And I think that our executive board and also Maria, who helped create this presentation, found this quote. We really just want to show how we value just keeping up with new scientific discoveries. All of our reports, any report that you read today is going to be found within the previous 4 weeks. That's one of the more critical things about our organization, is that all the papers that we're reading about, everything that we're talking about in real time has been published or posted on bioRxiv or medRxiv within the past 4 weeks. And this is one of the things that we just think is just so important for just trying to maintain the speed of science. And yeah, does anyone have any questions?
Now it's the time to ask questions from Nina before we move on to the next presenter. And Nina, correct me if I'm wrong, but you're gonna be here, right, throughout to answer questions if they pop up?
Yes, that's correct.
Okay, perfect. So if you guys can think of any questions, can you tell me what, so I have a couple. First of all, when do you recruit, when students can join, and what do they need in order to join?
So we are recruiting people all year at any time because we're a small organization and we just want as many people as possible. It's really easy to get people up to speed and like just participate. Anybody can grab the ball and come play with us. Like it's very open and welcoming environment. As long as you put in the work, you can really make a lot more of yourself. It takes a lot of initiative, but the only thing is to get access to our networking privileges, you'd have to actually read scientific literature. So we have a Google form where people read scientific literature, and it's very easy questions. You can just read the abstract. So if you just kind of read articles in your free time and just try to answer our questions, then you can get access to our networking privileges. And we have a system in place on how many times you can miss form submissions and still have access to our networking privileges. And but also I'm going to circle back to applying. So if you'd want to apply and just join and participate in any of our activities and try to get our networking privileges, then and also just like to help disseminate science whenever you can, that's cool too. You can just go our Google, we use a Google form to recruit people, and we just generally accept people that are UCLA students interested in science. And we even accept people that are psychology majors and sociology majors because there are papers on it. So we definitely want to promote like more people reading literature. So if you just go to this link tree, you'll find our Google form, and then as soon as you complete it, as long as you meet the general criteria, then you'll be admitted and we'll introduce you into our network.
Thank you, Nina. If you can drop the Linktree link in the chat, that would be awesome. And for the interest of time, I'm inviting Hannah Lee to introduce our next student organization.
Yeah, hi everyone. I'm Hannah. I'm the Director of Member Development for Scopeational Advocates, and I'm going to share my screen to tell you guys a little bit more about the organization. Oh, and can you enable screen sharing? Thank you. Okay, so let me know if you have any trouble seeing this. But basically, Scopeational Advocates is a collaborative effort between UCLA physicians and students that really aims to conduct social casework with patients that come from all walks of life. And advocates are typically paired with attendings from UCLA Health to carry out needs assessments and really identify their social determinants of health. And the way this works is essentially a two-step process. So first, we see patients individually alongside families to really identify these areas of needs. And the next step is to deliver and follow up on these personalized resources by using internal resources like mind maps along with external searches. And we send these personalized resources typically through MedNets and also occasionally through phone calls. And a really important note is that during COVID, similar to a lot of other pre-health organizations, our volunteering services have been paused, but we are working super hard to get everything back working again and constantly receiving updates from UCLA Health. But until further notice, all of our caseworking and operations have moved online. And beyond the clinic system and clinical operations, another really important part of our organization is the project team system. And this really allows members the freedom and the creativity to spearhead issues and causes they're really passionate about. And right now we have 7 main project teams, and the ones outlined in blue are the ones that typically recruit new members come fall. And I will be sharing a little bit more about them in these next few slides. So first is the resource project team, and they basically help discover new resources and maintain the current/existing database of resources through mind maps. And they also discover and organize community resources to respond to health needs, along with researching public health concerns and how to best address them. And on this slide, you can see a couple of examples of the project the resource team has finished last year. These are really detailed one-pagers that each address a specific resource topic that is in need in the Los Angeles community. And you can go to that link to explore all of our available ones. So next is a member development, which is my project team. And we basically support the professional and academic development of all PHA members. And this also involves spearheading internal and external public health programming. And you can see a couple of examples of events that we hosted in the past on these slides. We've planned a lot of public health panels prior that you can see on our website. And we also have one upcoming that we'll share a little bit more about later on. So next is community. And as you might tell, community is all about strengthening the social bonds between our members and organizing really fun events like retreats, socials, and banquets to get to know each other and support each other. And on the left, you can see an example of a medical school resource document that our members compiled last year. And we have a lot of other like professional and academic support resources available for pre-health/pre-med students in our organization. And next is technology. And technology is the project team to join if you're interested in data science, coding, or any form of computer science. And their mission is basically to create tech-based improvements to our clinical workflow and also develop new methods to receive patient feedback through quality assurance. And on this slide, you can see an example of a project that our tech team created from scratch called Phase. It's basically a database that helps you filter and customize the type of resource you're looking for. And you can also kind of explore this new resource on that link. But if you're interested in kind of conducting analyses like these, it's definitely worth a shot to apply and learn more. And next is health systems, and they are the liaison between our organization and UCLA Health. And we really facilitate the transition between remote to in-person volunteering and vice versa. So beyond the project teams, members also attend bi-weekly GMs once a week, and they cover really useful topics in public health, along with featuring super cool guest speakers. And this quarter, we actually hosted a couple of guest speakers with experience in public health, medical school, climate change research, and more. And all new members also take part in a fall class that is typically 2 hours each week. And this is a really important part of learning to become a patient health advocate and getting ready to interact with patients inside the clinic. And basically, we emphasize how social determinants of health can influence health outcomes. And they also learn motivational interviewing skills to prepare for the interactions and conduct their intake survey for patients inside the hospital setting. And before I conclude this presentation, I wanted to share a public health panel that's coming up on Monday of week 6 from 7 to 8 p.m. PT. And this is going to cover really cool topics in public health, community health, and policy, and how all of these different spheres kind of intersect. And so if you're interested in either a career in this field, or if you're a pre-health / pre-med student interested in learning more about how this can kind of intersect or combine with their own personal interests, I would definitely recommend you RSVP at the link over there. And it's open to students of all years and majors, including non-UCLA students. And you can see the 3 panelists who are coming listed down below. So Dr. Gurnani, who serves at the Department of Pediatrics at David Geffen, and Dr. Eisenman, he's a faculty lecturer at the School of Public Health and has a lot of experience with climate change research and sustainability. And Dr. Tony Kuo, who has also served in the Public Health Department of Los Angeles and also serves as a lecturer in the School of Public Health. But again, you can RSVP at tinyurl.com/PhD panel winter 22. And for a little more on what kind of applicants we're looking for, most importantly, we really prioritize passion, empathy, and commitment for people who are ready to go in clinic. On the other hand, we aren't necessarily looking for people who are not team players. We also don't really look for prior experience, so you don't have to worry about getting shadowing experience or like clinic experience beforehand. And we also have no specific majors or minimum GPAs that we're looking for. So it's open to students of all years and all GPAs. So if you are interested in joining, applications typically open every fall quarter. And again, they're open to all years and majors. And if you're interested in receiving updates about the application process, you can definitely sign up for interest form at tinyurl.com/PhD interest form 2021. And also feel free to follow us on our social platforms for updates. We're on Instagram, Facebook, and LinkedIn, and we also occasionally post blogs on Medium. And of course, feel free to explore our website for a better idea of the different projects we do and the different resources available. And before I end the presentation, I wanted to ask if you guys had any questions, but thank you for letting me present, and I hope you guys all have a great rest of the day.
Thank you, Hannah, and feel free to put questions into the Q&A for Hannah. And Hannah, if you want, you can put the contact information in the chat for everybody so they can copy. And we're gonna move on to our third group. So Sartaj and Rachel, can you come on and share information with students? Welcome.
1 second. Cool. Hi, everybody. Hope you're having an amazing day. We're gonna be
We have a little bit
about-
of difficulty hearing you, Sartaj. I don't know what's going on, but you're nope.
Okay, 1 second.
Now it is good.
Oh, it's good?
Yeah.
Okay. Cool.
Sorry.
Sorry about that. No, that's my bad. All right, cool. So hi again, everybody. Hope you're having an amazing Friday. Rachel and I are from the External Relations Committee of Medical Aid Initiative, which is a student organization that works on distributing access and unused medical supplies from the UCLA health system to under-resourced regions across the world. So now we're going to be talking to you a little bit about the medical waste issue first. So what exactly is healthcare industry waste? So medical waste is any kind of waste that contains infectious material or even material that's potentially infectious. So this could be any waste from any medical facility, so doctors' offices, hospitals, dental practices, and surgical gloves. So for some astounding stats, US hospitals actually produce over 6 million tons of medical waste each year, and health facilities alone can generate up to 33 pounds of waste per day per patient. And the UCLA health system itself generates 12.8 9 million pounds of waste annually. So the question is, why is there so much waste in the industry? Well, a lot of it has to do with the environment of care. So during a case, things are pretty complicated, time is limited, and processes and procedures need to be kept as simple as possible with an emphasis on infection control and patient safety. So actually, by US standards, once supplies have been opened, they either have to be used or are thrown away. And then also in terms of inventory, supplies may also become expired. So that's where medical aid initiative comes in. So just for some brief history on our organization, we were founded in 2017. And the thing is that unused supplies collected in the United States can actually be reallocated internationally. So with that, a twofold impact is that we can reduce excess medical waste in the US, and we can also help aid healthcare in other countries that could really use it. So this beneficial relationship founded Medical Aid Initiative. So our mission has three main tenets: sustainability, distribution, and awareness. So for sustainability, like I mentioned, our main focus is reducing medical waste in the UCLA health system, kind of having an eye towards how climate change and how healthcare is impacting climate change. Our second part of our mission is distribution. So that's where we have a warehouse, as Rachel will get into a little later. That's where we distribute unused medical supplies to underprivileged regions from there. And lastly, one of our other tenets is awareness. So awareness of medical waste and creative ways of how we could partition resources. So awareness is a really big deal because a lot of individuals, a lot of us are pre-health students, so we actually don't know about this issue of medical waste and how we can promote medical sustainability. So just kind of getting that conversation out there a little bit more so that hopefully when we're all future leaders of the industry, we can take this into account as a foundational aspect of healthcare. And to help accomplish this mission, we have 5 different committees. So those are external relations, donations, warehouse, finance, and publicity and socials, and they all contribute in their own ways. And now I'm going to pass it on to Rachel.
Hi guys, so our kind of process is we take unused supplies from various UCLA health facilities such as Ronald Reagan and the UCLA Santa Monica Medical Center. When we receive the supplies in our section of the Michigan Operations Center, this is the warehouse where our members diligently volunteer and sort through and organize these items for distribution to the UCLA affiliated mission trip organizations. These organizations are going to use these materials to conduct clinics in under-resourced areas across the world. And during the pandemic, many of our supplies in our inventory were actually used to provide aid locally, and we were able to make donations to Beirut after explosion that occurred in Haiti after the earthquake. So here's just a few images of our warehouse space where members volunteer. And feel free to check out the QR code on the bottom, if it's showing the QR code, to see what our inventory is about and request supplies from us using our donation request form if you are a part of the UCLA affiliated organization. I don't know if the presentation's lagging a little bit, but that's our QR code. Feel free to scan it and look through our inventory and fill out the request form if you need to. And so our impact. We have overall reduced 4,215.3 pounds of medical waste. It has been sent to 20 nations, and this has been done through 940 hours of student volunteering. And this number is growing every single day. And just to give a visual of actually our worldwide impact, we have a map here that shows kind of all the different countries and how widespread our donations have been sent to. And so thank you so much for tuning in today. Make sure to check out our website to sign up. I don't
I think we lost Sartaj. Yes, he's coming back.
Okay, I'll just wait then.
Sorry, 1 second. I think my internet's really struggling today. All right.
Okay, So thank you all so much for tuning in today. Make sure to check out our website to sign up for a mailing list. We usually recruit in the fall if you'd like to join us. And you can also check out the donation request form on the website if you'd like to request supplies for your UCLA affiliate organization. If you have any questions, we're always happy to answer them via email or social media. Thank you guys so much.
Thank you very much for all the presentations. If you have any links you want to drop in the chat for students to save, please feel free to do so now. I'm going to stop the recording. Thank you again for coming.